Hi, good evening. I'm Richard Hurley. I'm a journalist at the BMJ, the British Medical Journal. It's a weekly magazine that most doctors in the UK receive. In 2016, the journal called for pragmatic and evidence-based drug policy reform. Rather than focus on law and order, it should prioritise health, is what we said. And it should include the cautious exploration of appropriately regulated legal supply of drugs like cannabis. The decades-long war on drugs has not stopped drug taking. Illegal drugs like cannabis are readily accessible in the UK. At least 3 million adults and children said they used cannabis in the previous year, and a quarter of 15-year-olds have ever used an illegal drug. So clearly prohibition hasn't worked, and it also means that there are no age checks on sales and no quality control. People don't know what they're taking or how strong it is, and prohibition has other harmful consequences. It stigmatizes drug users, it denies them the chance, or denies any chance to offer them education about the harms of the drugs they're taking, or advise them about treatment if they're worried about their drug use. Portugal removed criminal penalties for the users of all drugs, not the suppliers, but the users in 2001. And such decriminalisation is recommended by bodies like the World Health Organization, lots of UN bodies, and even the UK government's advisory committee on the misuse of drugs. Doctors' organisations are now following that line, and there have been recent calls from the BMA, the British Medical Association, and this year from the Royal College of Physicians that drug use should be decriminalised for all drugs. But that still leaves people having to buy or needing to buy or wanting to buy drugs like cannabis from an unregulated, violent criminal market, and well, for cannabis now dominated by high-strength skunk. Cannabis use is harmful, associated with increased risk of mental health problems and dependency. Legal controlled supply should not be seen as an end in itself, but as part of a package of interventions, including investment in education and treatment services that promote health. And regulation must prioritise public health. The profit motive in markets for legal drugs like alcohol and tobacco often compete with public health endeavours as industry works overtly and covertly to maximise revenues. And tax revenue may also introduce an incentive to drive up use. So the BMJ says we should reform drug policy, including legalising cannabis supply, to prioritise public health rather than ideology or profit. And we should proceed with caution, we should collect evidence of the health impact, and we should look internationally to where this is already happening. And we should learn from our successes and failures in regulating currently legal drugs like alcohol and tobacco. Thank you.